All right, well, let's go ahead and get started. Good afternoon, everyone, and thank you for joining us today for the power of the right partnership, how using the right staff scheduling technology can help take a bite out of the staffing crisis. Brought to you today by the online staff scheduling platform called EasyShifts. We would like to give a big thanks to Senior Housing News for all of their help and guidance in preparing for this today, and we're also very thankful for all of you joining us today for this webinar. Before we get started, we'd like to do just a quick overview of what we're going to be talking about today and kind of an opening statement. So, as we know, the recent shortage of workers in the healthcare industry is taking its toll. Many can attest to numerous challenges this shortage has inflicted with our companies, their personal lives, and their well-being. We all want well-staffed, effective, and positive workforce, but with staffing shortages plaguing the healthcare industry, many feel that simply cannot be accomplished, at least not without cutting into a community's ability to provide better for their residents, families, and team members. We'd like to share some strategies that have been used by your peers to cope with these challenges and how the right partnerships really do matter. Our belief is that staff want flexibility. If they don't get flexibility and a healthy work schedule from a full-time position at a facility, they are going and finding it elsewhere. They're finding it from agencies, and in recent years, they're finding it by working through apps that enable them to pick up shifts nearby. They're essentially able to work when they want and generally make more money than they make per hour in their traditional jobs. Many of these apps and staffing companies only came into existence in the last 2 or 3 years, benefiting greatly from the pandemic, making record profits, taking profits away from the ability of our communities to provide more for our residents and their families. Is money really that much of a motivator, or flexibility the biggest motivator? Our staff and your staff wants flexibility. We at EasyShifts believe it is you that can offer it to them yourselves. About this session today, we would like this to be an interactive session and an interactive discussion. If you hear something that either sparks a question or piques your interest in knowing more, please add your question to the chat box in the question and answer area, and we will address them as we move through today's discussion. I want to first take the time right now to introduce our panelists. I'm going to allow them to spend a little bit of time talking about themselves. First, on the top left, we have Chad. Chad, will you fill us in on your career and kind of your expertise and where you might be located?
Sure. I'm the executive director at Maplecrest Manor. We're in Ripon, Wisconsin. We're a rural community of about 7,000 people. It's a little bit of an unusual community because even though we only have 7,000 people here, we have 7 assisted living facilities in Ripon, which makes the staffing kind of interesting in our town. I lead the executive leadership team here, and I'm responsible for the strategic direction of Maplecrest Manor. We're an apartment-style assisted living. I also have another company that provides supportive home care out in the community called Maplecrest at Home. So I've been in my current position for about 12 years. I've been working in healthcare for over 30 years, and I really focus my efforts greatly on creating culture where employees feel valued and can contribute to the direction that we're going. So the culture is very important here.
Chad, thanks so much for joining us today. We sure appreciate it. And now we have Marissa. Go ahead, Marissa.
Hi, everyone. I am Marissa Janke. I am the campus administrator at EagleCrest North, which is in Onalaska, just north of the La Crosse area. And I am the housing director for our organization. So I supervise directors at 3 of our other assisted living facilities. I work with assisted living, independent living, and memory care, and have experience as a nursing home administrator prior to coming here. So I've been in the long-term care industry for just over 10 years, working in the SNF world and then moving to assisted living, kind of a strategic move. And I thought it would be a little easier than the nursing home, but I'm wrong. And it's just very different. And so I appreciate everything that the nursing homes offer to the continuum of care, as well as the assisted livings. And I also, like Chad, focus really highly on culture and think how we treat people and how we interact with them is how we're going to keep them. So we're here excited to chat with you.
Great. Thanks, Marissa. And next we have Tom. Tom?
I'm Tom Kosman. I'm the executive director with the Cottages Senior Living and Memory Care. We have 3 locations in Shawano, O'Connell Falls, and Manor, Wisconsin. We started just in Shawano. We've kind of grown over the last, I've been with the company 10.5 years. We've really grown to the 3 campuses since then. We have senior style apartments, and we also have memory care assisted livings. Before that, I was a caregiver as well in a memory care facility. So about 15 years experience overall in healthcare. And yeah, I feel like I'm kind of copying them and piggybacking off of culture and things like that. It's really important for people to have a job that, number one, they enjoy, and number 2, they feel welcomed, heard, appreciated, all those things in. I think we all know in healthcare, money's not always there. It'd be great to be able to pay our caregivers $20, $25, $30 an hour, but we can't do that. So what else can we do to make sure they know they're appreciated, make sure they know they're valued, give them that flexibility, give them benefits that make them want to stay in our field, and hopefully with us as well. I'm excited to talk to you all about that as well.
Thanks, Tom. And that's a great segue into just our conversation today and some of the things that we're hoping that you're going to hear as we go through this webinar today. First, our goal is we're going to talk a little bit about our thoughts on federal staffing mandates and how this may help or hinder the growth of our team members. Thoughts on why people are leaving healthcare as a career. We'll be excited to hear what these 3 professionals have to say about that. And really, too, as we talk about culture, thoughts on how to celebrate wins and how to overcome challenges. Those are important things as you try to build culture, and things that we need to celebrate those small things. So we're going to talk about that and a whole lot more today in this hour that we have with all of you. Well, let's hop in and let's get started with the first question. So first, we would love to get your thoughts, either good or bad, on the new federal staffing mandates. And we're going to start this question off today with Marissa. Marissa, what are your thoughts?
When I heard about this, I think I went through a myriad of emotion. Frustration, disheartening, I think, are the 2 biggest feelings. It really made us feel as providers like the federal government truly does not understand what we do, how we do it, why we do it. And I think that's the most difficult piece to swallow. We would love to be fully staffed 24/7, 365. We would love to not have agency staffing. We would love to pay our staff, like Tom said, a better wage that would attract more staff. And the issue, as we've stated from the entire time that I've been in healthcare, is the reimbursement has to follow. We pay them as much as we can to as close to our bottom line as we possibly can while staying in business and being fiscally responsible. And I was very disheartened to kind of see that we were sort of the scapegoat for all of the issues. And certainly our staffing issue is not unique to long-term care or even healthcare in general. It's a crisis all across the country. So when I read this question, Ben, I felt like we could talk just about this question the entire conversation. So those are, I think, the quick and dirty summary I felt of how we felt.
Sure. No, and I think, Marissa, I think it's a valid topic to have a pretty healthy conversation on. So as Chad and Tom share, if anybody has anything they'd like to throw in, feel free to do that in the question and answer section. And Marissa, is there anything you want to bounce off of what they say? Please do not hesitate. So Chad, what are your thoughts?
Well, I'd have to agree with Marissa. I shared a lot of the same feelings as they came up. I think we're closely watching to see how this plays itself out and how it affects our businesses, especially in assisted living. And through my involvement with advocacy, I have some contacts, and so I've reached out to people, and it really is kind of watching to see how this plays out. I haven't seen much of an effect quite yet, but it's still very, very new. So
great. Thanks, Chad. Tom, any thoughts from you?
I'm really echoing everything that both Marissa and Chad said. Yeah, and the really key point that I felt was like being a scapegoat, as Marissa said. Like the big bad wolf that's doing these things wrong. I mean, that's nobody's trying to not have enough staff. I don't think that's the goal here. If in a perfect world, we'd have more staff than we maybe know what to do with. But we don't. We're doing the best we can, trying to pay the best we can and take care of our team, but also it's a tricky thing. Could these mandates help and be a stepping stone to getting those reimbursement rates, because we can come back and say, well, look, if we have to do this, we need to, will that help? Maybe, I don't know. With government, we never do know. So yeah, it is kind of a watching and waiting thing.
Great. I have a follow-up to that point, and I would love to hear what your thoughts are on this. How do you think that these new mandates may play into the growth, and then also on the other side, maybe the hindrance of growth of your team members? As team members want to do more, right? Team members that are LPNs want to become RNs. Team members that are caregivers want to maybe go into nursing. Nursing maybe wants to go into administration. Talk about how this may hinder or help kind of your team members as they look to grow. Let's go with Chad. Chad, what do you think?
I worry about especially somebody's professional growth, and when there's mandates that come down from the federal government like that. How, if we want to promote people from within into more of a management position or a lead position, but it means that by doing that, we create a vacancy to do that. And so when you create a vacancy, how are you going to fill that? And if we have mandated requirements, the timeliness, I'm concerned about how to meet requirements, but yet do what's right for the organization. I worry about, will positions open in other facilities? Will staff leave to join another facility because of these opportunities? We're doing pretty well right now with our staffing at Maplecrest. We really are. And so I just work so hard with all the culture pieces that I'm doing right now in hopes that even though there are these new federal staffing mandates, that maybe we can avoid losing people or it being as much of an issue, but it's still so early on to know how it's going to affect us.
Sure. Good. Tom, any thoughts on growth or hindrance of employees due to the mandates?
I think, it could help with growth of employees in terms of going up the ladder, if you will, from position, say from caregiver to lead to, but as Chad was saying, it might not be with that company. So it's kind of tricky. I would think from a personal standpoint for somebody, it might be easier or help with their growth because they could go elsewhere depending on their location, of course, and find a higher up position with another agency or another company. But as far as companies go, I don't know. I don't know that I see it being I don't know if I see it being a positive. I can see it being more of a hindrance because if you are losing those good team members because you don't have a position that's open for them, or you can't promote them for one reason or another, your whole company then kind of doesn't get to grow because that person that you've groomed and you've grown to the point that they are is now leaving, and then you may have to start back over again.
Sure. Great points. Marissa, anything?
Of course, I agree with both of the gentlemen here. And I also think it would prevent or potentially prevent people from attempting to go into those leadership positions. The stress that we all feel has never been greater, and adding something like this is totally out of our control. We can't create people, right? And so, I mean, we can, but it takes a long time. So I think the longer we have our finger on the healthcare, long-term care sector, the less likely people are going to be joining this industry. And especially as leaders, you have to be dedicated and you have to believe in your mission, and you have to have a lot of great qualities that you can transfer into another industry. And so that's really what I worry about. We may finally get to the staffing pattern that we need, but our leaders are so exhausted that we don't have folks in the industry who know what they're doing any longer.
No, that's a great point. And it's a
Sure.
great segue to the next question that we are going to pose to the three of you. You know, an honest conversation about why you think people have chosen to leave the healthcare industry. You know, since COVID, even I think maybe it started a little before COVID even, but COVID obviously was a big push behind people maybe moving away from the industry. What are your thoughts as you see people that have left to go to different things? Is it a pay issue? Is it a flexibility issue? What do you think it might be? And Tom, we're going to start that question with you.
How much time we got, Ben?
Hey, we got till 4:30 according to Grace
Okay,
from
no,
Aging
I'm just
Media.
kidding.
Go for it.
Boy, yes to your question. You know, is pay part of it? Sure. Is flexibility part of it? Sure. As Marissa said, is the especially for leaders, but for really anybody in healthcare, if you haven't experienced or even felt some burnout in the last, especially 3 years, I praise you because I mean, I know I have. You know, trying to do something as needed as providing healthcare services to another individual, especially in long-term care. We're talking about, you know, frail elderly. I have residents with dementia. You know, having to tell families and visitors you can't visit your mom or dad because in the building because you could bring COVID in, and that was disheartening. I know for me, I know a lot of my colleagues felt the same way. You know, and probably everybody on this call probably felt the same way too. But I think the reason is, yeah, you can, I mean, there's jobs really everywhere. So if somebody's not happy with their pay or their boss or their shift or not enjoying what they do, they can go anyplace else and do that. And in some industries, like again, I'm not knocking retail or I'm not knocking manufacturing. So those are difficult jobs too. But they might not have the same psychological difficulties that a job in healthcare has. You know, senior living, I can't just close the door at 5 o'clock and say, okay, Sally, you're in charge till morning. We'll be back then. I mean, the doors are always, you know, somebody has to be here. People have to be here. People have to be taken care of. So it's a 24/7 job that can be very grinding and grueling. And it can be very rewarding too. But I think especially in the last few years, because of all those other things, it's taking the rewarding aspect and pushing it down the ladder of what a person is feeling. That's at least my personal experience with it anyway.
Sure. Great. Marissa, any thing you would like to add?
Yeah, I think, of course, every single thing that Tom stated, and I think the pressure too that our staff are feeling. You know, they all went into healthcare or caregiving, nursing, direct care, even food service and maintenance in this industry because they care about people. And when they are pulled in so many directions, they aren't feeling like they're giving their best to their residents. And that's not why they went into the industry. They went in because they wanted to feel good and they wanted to feel like they were making that impact. And although they are, it's not in the same capacity that they thought they would. And so they feel this sort of inadequacy that they're not doing enough. And therefore they can't really, that doesn't sit well with them. And so eventually they go elsewhere.
Got it. Great. Great. Chad, anything?
You know, I would agree with what both Marissa and Tom said too. You know, we talk about ourselves experiencing burnout and maybe our managers and our lead people experiencing burnout, but we need to remember our caregivers experience the burnout too. And I think one of the reasons that I believe that people have chosen to leave healthcare is because of that inadequacy that they're feeling just meeting the needs of their families. Sure. And spending time at home. I think that there's often frustrations with us as managers and administrators because we have to mandate overtime. And so we've tried to minimize that as much as we can, or at least give as much notice as we can to make those requests easier on them. And remember that they have families just like we have families. They have things that they want to go do and enjoy away from work, just like we have things that we want to do when we're away from our work too. I think another reason that people have left that we've noticed, at least in sort of this rural market that we're in, is childcare, lack of childcare. has made it especially difficult for us to find staff to work on our evening shifts.
Yeah.
The caregivers that have young children, especially, they want to be home to see kids off to bed or assist with homework and those kinds of things. And so it makes it difficult. You know, since COVID started, I've not had any issues finding anybody to work the overnight shift or day shift. Evenings are a challenge, though.
Gotcha.
I don't know if others are experiencing that.
Yeah, that's good to know. So that might have been the easy part of the question. The more difficult part of the question is, how do we stop it? What steps can we take to maybe slow it down and maybe show the rewarding piece of what healthcare is really all about? So I'd love to get your input on what that looks like and maybe how we keep people you know, in those daily schedules and some of those challenges that you have faced. Would be curious to know any thoughts on how maybe we stop it. Whoever wants to go first.
I think,
in no
yeah, I
specific
think the
order.
more that you can just be proactive and really listen to your employees. Some of the things you can't prevent, right? Like Chad's example, you're not a daycare provider, you're a healthcare provider. So unless you have a daycare within your campus, you probably can't combat that issue. And we all know that that's a national issue as well. But what you can change is what we try to change. So even simple things that irritate the staff, like our washing machine hasn't worked for 3 weeks, and it takes an excessive amount of time for us to do these residents' laundry because we only have one washing machine. Like fixing that as quickly as possible, and communicating about it. And sometimes we over communicate because although we tell one staff and they gossip about everything under the sun, not the stuff that we are doing. So ensuring that we are communicating those things to the employees as quickly as possible and fixing them within our power as quickly as possible.
Great points. Chad, anything from you?
For me, one of the things that I had to learn was that I don't have to create the magic winning program to come up with this, and then implement a program. So for me, the easiest thing that I've done is just asking the staff, what is it that frustrates you? What is it that makes it difficult for you to get through your day? And I'm surprised at quite often it's the little things that can make a difference. Getting that washing machine fixed, like Marissa said. You know, maybe the copier isn't working correctly, but nobody said anything. So it's little things, little frustrations like that. But it's me being out of my office and asking the staff as I'm walking the hallways, and doing my best to maintain a positive attitude with any interaction I have with an employee. Always asking them about their family, always asking how's their day going so far, anything I can do to help them. At first I was afraid to ask that for fear what I might hear, but that's what they're looking for, is what I find. That along with flexibility with their hours, flexibility with scheduling, some job sharing kinds of things, taking jobs apart like that, and have all been things that I've done here at Maplecrest.
Great. Good. Tom, anything you want to add?
Listen, you know, and then when you do listen and you get that information, you know, we have to do something with it, right? I mean, it's making sure that if we have a staff member who, you know, like use an example of the building I'm in right now, there's I'm not sure how old he is. I'm terrible at judging babies' ages, but we have a caregiver whose baby is here right now with his little walker, because grandma cannot pick him up until 3, but she started work at 2. We were able to make that work. Residents love having the baby around. It's not affecting anything or anyone. So we're able to help that caregiver out. She feels incredibly appreciated, and we have somebody that can take care of our residents in that shift. You know, so listening to what they need, and then celebrating the wins, no matter how small they might seem, you know, referencing or not referencing, but kind of forcing your team, if you're having like your end of shift walkthroughs or whenever you're having a meeting, it's easy to talk about, well, the washing machine's broken. I don't like our shirts. You know, it's also important to talk about, you know, hey, we were able to finally get Mary in the shower, and it hasn't happened in 2 weeks. So we were able to again, with the situation with this caregiver, offer that as an option to have her son come in for a little while. We even today we had a celebration. We had some team members who had gone through some extra dementia training. So we got them, a jacket to show them that and a name tag and things like that. So celebrating those wins, however small they may seem, are really important, because it's easy to always talk about what didn't go well today. It's also very important to talk about what did go well today, so that hopefully that job satisfaction comes into place, and it's not just, well, this is wrong, this is wrong, this is wrong, this is wrong. True, but this is good, this is good, this is good, and this is good.
Yeah. Love it. And all three of you had a common theme, and it's really listening, right? I can remember when I was in leadership of campuses, it was always every morning was management by walking around, right? I walk around, see how everybody was doing, check in for the day. They knew I was present. And I think that that's always a key to let them know that you're an accessible individual and that you have their interest while they're with you in mind. And I think that that's an important piece. Well, let's jump into, this is a staffing summit. We talked for the first 30 minutes about some pretty solid topics and some things that are affecting everybody. But, this is really to talk about staffing. So tell us about your biggest challenge in staffing and how you overcame it. And then on the flip side, your biggest accomplishment in regards to staffing, and then how did you celebrate it? I think celebrations are important to know about, as well as some of the challenges and how you overcame it. So Marissa, do you mind we start with you?
Sure. So in my current position, when I started, our nurses were essentially on call 24/7, 365. There was a rotation, but they didn't really follow the rotation, and said if their issue that was being called about was related to their unit, they were the point person. It caused almost every single one of my nurses to leave. That was their final reasoning for leaving. So we've made a lot of changes with our staffing on call. We've created a lot of new positions. We've created some remote positions to support that after hours nurse call. And you would not believe the number of applications that we got for a remote nurse, like literally 300 applicants in a day, because they want to work remote. And so we could really pick who we were going to have to support the nurses then. We've done the same thing with them. They were kind of that last call person, they and or their director, to support when there's a call in, which we know it's going to happen, whether legitimate or not. People will call into your shift at times, and having that backup plan, a plan A and a plan B, has been really helpful for our staff, our leadership nurses, and our managers to feel like when they leave for the day, they know that they are done and they can enjoy their time with their family or their friends and kind of put work out of their mind until they come back in the next day. And I think I was really good at that prior to COVID. I trusted my team. They were so solid. I knew if they called me, it was because the regulation required them to. Where then, we were obsessively looking at COVID and figuring out what we should or shouldn't do. And the regs were changing so often. And so we really kind of became habitually involved with looking at and involved with work outside of those office hours. And so I'm really working with my teams on, you're here for 8 hours or 6 or 4, whatever your shift is requiring you to be, and then you're done and you have your life outside of work. And so those are some big wins. Creating those positions and being successful with them is something that we've done really recently. And my hope and my goal, although lofty, I will acknowledge, is to have our nurses entirely off of call by the end of this calendar year. So we're really hopeful that that can be done, because that's really, we all know nurses are just as valuable as our caregivers, as our administration staff, and are pulled in every direction possible. So the more we can do to keep them happy, the better.
Great. Thank you, Marissa, for sharing. Tom, anything you want to add?
I think our biggest challenge and our biggest accomplishment can kind of come together. So, we have a set 2-week rotating schedule. And our policy for call-ins is we don't have you can't just call in and say you're supposed to, you have to find your own replacement. Now emergencies come up, I get it, your team will work with you, but and the other part of it was just keeping the team accountable. That I know it's easier said than done, because people are like, well, then I'm not doing this job, and that's okay. Like, if that's not going to work for you, that's okay. So it created a challenge in that, I shouldn't say created, because we've been doing it since before I've been here. But the challenge it creates is then, okay, you might not have as many staff because people are not willing to do that, to find their own replacement if they're sick, if their kids are sick, if they got vacation. But also once you can get past that and you can show the team why it's beneficial to them, it creates that flexibility that we've all been talking about, that you can make your own schedule, you can find your own time off. You don't need to run it through me, as long as it's not an overtime. Generally speaking, I don't care, as long as you're able to make that switch. It gives you that flexibility to make your own schedule. And then people do eventually, they start buying in, and we're seeing that, especially in our newest community. That was something that wasn't being, I'll say, policed very well. The staff was able to text or call the manager at any and all hours, and she would take care of it, or she would, and it burned her out. And we tried saying, don't do that. But she's like, but if I don't do that, then I'm not going to have any staff. And it's like, well, you will. The team will come together and we'll work through it. But so that challenge kind of became an accomplishment. It's always a challenge and an accomplishment. It's never fully done because you get new team members or things that change. But really having that accountability with your team can make it an accomplishment.
Great. Chad, what would you like to add?
One of the biggest challenges we run into is that burnout for the on-call weekends, after hours, just like Marissa was saying too, and what Tom was referencing. And what we implemented was before a weekend call, the staff person that will be on call always has the day off before and the day off after, if they're on call. So if they're on call from a Friday at 5 till Monday morning at 8, they're off on Friday, the whole day Friday up until 5, and they're off on Monday, the rest of the day Monday, just to respect their time. Most weekends, there aren't many calls. There really aren't, but it can be really frustrating to them when they get calls and lead to burnout. And so prior to this, what happened was they were expected to work their regular hours all the way up until 5 o'clock on Friday, and then still be on call for the weekend, and then show up on Monday morning. And so we recognize that time off before and the time off after is super important. And so that was probably the biggest change we made. There have been little things. Tom mentioned that there's a child there with right now. We've had to do some of that. My wife is our activity director in our building at the moment, and she's picked people up from preschool and run people home after school, or met kids when they get off a bus so that a caregiver can be here. So we've had kids dropped off at our own house, and then caregivers come. So we've done some of that kind of thing. The employees the team, just like we make an effort not to burden them, they don't want to burden us too. And we know that and appreciate that. The way we celebrate it, though, I've always believed that we want to make sure that we're praising people publicly. So we always start out with wins and talking about wins. At every single meeting we do, you start with wins rather than jumping into any issues. If there's anybody that we need to bring in for any criticisms or anything like that, that's done privately. So we never criticize publicly. So that's just an important thing. And our management team talks about that all the time, that it's praised publicly, criticized privately.
Great. Well, thanks to all of you. The next question that we were going to ask had to do with burnout. But I think a lot of you actually in that last section did a great job with talking about maybe some of the things that you have done to help with staff burnout. Is there anything that you would say that a schedule or more specifically a scheduling platform like the EasyShifts, using something like that, how can that help with the reduction of staff burnout? Marissa, anything?
Yeah, so I think one of the guys mentioned the ability for them to totally set their own schedule. We also do a 2-week block, so they know exactly what they're supposed to be working for the next eternity that they're going to be working with us. They know their holiday rotation right up front. And then they know that every single other employee listed in EasyShifts is someone that they can reach out to if they want to have them pick up a shift for them, or if they need them to pick up a shift. The up for grabs option is really nice. So then the staff know that this person is maybe interested. It's also kind of nice for us as supervisors to say, hey, I see your shift is up for grabs this weekend. It's so I said I live in the La Crosse area. It's Oktoberfest this weekend. So anytime I see a shift up for grabs on Oktoberfest makes me a little nervous. So I always will say, I see you probably want to go to the fest grounds. Do you have a backup plan? And they're always really honest, and they're just saying, I threw it out there to see if anyone would take it. Don't worry, I will be here. And having that accountability with us and them is really nice. Them being able to totally set whatever they want, have their time off whenever they want. And like Tom said, I don't really care who's working because you're all qualified. I just need someone in the building.
Great. Chad, anything you'd like to add to that question?
Yep, I would just echo everything that Marissa just said. We use EasyShifts the same way. We have the 2-week block, just like both of them do. And I love that they can put shifts up for grabs and use that feature. I like that there's no more filling out a form and it has to be signed by both people, turned into me. I have to adjust an Excel spreadsheet schedule and then repost it again. It removes me out of the picture from doing all of that, because just like Marissa, I really don't care who's here. I don't care who's working.
Yeah.
We make sure that everybody is qualified to work every shift.
Yeah.
And so we've been able to avoid that burnout by letting the staff have that flexibility. They have more control over their schedule. We don't right now. I've not had issues with staff really trying to pile on overtime, and so I don't even limit overtime. If they want to have an overtime shift here and there and they pick it up and do that, I let them do that without even having to go through me. But I do monitor. I am monitoring that and have had no issues with it.
Great. Tom?
The only thing I can add on, I agree with both of them completely and all those things. And we talk about flexibility, and we talk, a lot of people want things like now. So the ability to pull up their smartphone, pull up the schedule, quick send that message out and or put it up for grabs. The ability to even split shifts, because you might have somebody say, hey, I can do the first half of your shift, but I got to be somewhere by 7. I can't do that. Okay, great. Well, they can take the first half. Now I just got to find somebody for the second half or something like that. I mean, that flexibility to not only just have that shift taken, but to have it split up, to be able to quickly reference it out without having to come back in the building or call the building. What's the schedule again? Who works that day? It's so much easier to have it in their hand on the app. As soon as everybody has a smartphone just about and a way of getting to the app or online, it works really well.
Let's move into the beginning part of the process of having an employee work for you all. How do you use technology and maybe even conversations about the schedule? How do you use that in the recruiting process and even maybe, through the hiring process? So what's your conversation look like? Let's go, Tom. Either way, Tom or Chad. Chad, go ahead.
Okay. I have EasyShifts open at my desk when I'm interviewing an employee. I talk about that they have access to it. I show them this. I talk about open shifts. I talk about how they can pick up partial shifts. So I use it right as a tool in my interviews, and so many people have never heard of that before when they're doing the interviews. And I've found that some people have made the decision to come on board with us because they're assuming if we do that, we do things like this in other aspects too. But we do. Everything is all technology based here. So it works really well, I find. And I even pull out my phone and show them the EasyShifts app, and I show them how we use the time clock feature, and that it's easy. You punch in right on your phone, you punch out right on your phone using the app. I actually punch myself in, punch myself out, and show them that it's just that simple.
Great. Good. Marissa?
Exactly the same as Chad. And I think one other piece is I will often tell them that, our staffing is pretty solid. We don't have a lot of openings. So we're not going to be calling you every single day. And, after you've left the building, or saying, hey, can you stay? Can you pick up this shift tomorrow? And showing them the schedule as it is and the limited number of green spaces that we have really reaffirms that I'm being honest with them. Because of course, everyone's going to say, oh, staffing is great. right. And then you come in and it's totally not that way. And so they can see it firsthand that, okay, truly this is a well-staffed building. And then it kind of reassures them that this must be a decent place to work.
Wonderful. Great. Tom?
I agree with all that stuff. And it also shows them right up front, because I do the exact same thing. I show it during my interview process. I think it shows them right up front the flexibility that we allow. You know, we have this technology that we provided for you. We don't have to. I could easily go back to having it posted in our med room or in our employee room where the schedule is. But this is a perk that we put in place solely for our employees to use, so that they have that flexibility that right here, right now, I can see my schedule, I can make a trade, but then also show, you know, yeah, we don't have a lot of green spaces. You're not going to be asked to come in every single day. And here's how you could find somebody to work your shift. You know, it's real simple and easy. So really just echoing what Marissa and Chad said.
Wonderful. So let me ask this question. How do you use the idea of interactive scheduling through EasyShifts in hiring and in the onboarding process? And has it allowed you to hire better? And what I mean by that is hire maybe better qualified individuals, maybe better individuals that fit your culture. You know, what does that look like? Tom?
You know, I would say for us, when it comes to the hiring and onboarding process, it lets us put that schedule right up front. The person can see exactly what they're doing. There isn't this, well, when do I come in for this training? When do I do this training? What am I doing today? We can set up times to, you know, yes, here's your schedule, but then, you know, right after that, we have, you know, on this day, we have a meeting period with me, your director, or somebody. So they know right up front what the expectations are in terms of the schedule. They know that we're going to be scheduling, you know, meetings with us as managers, so they can say, these people actually do care. They're not just saying, okay, great, you're here, you're hired, now go work. Like, no, we're going to give you these training days. We're going to meet with you regularly. We're going to ask you how things are going. If you need more training, if you need more of this, you need more of that, we're going to be able to do that. So it helps us. If it doesn't help us hire better, it helps us make our hirees better in that they know what's expected of us. And sometimes you might have a situation where you can kind of detect whether that new person you've hired isn't fitting that culture, and it's just not working because you're making that constant contact and using, you know, EasyShifts like this to have all that scheduled so they know what's coming. Kind of helps keep both management and the team on the same page.
Great. Chad and Marissa, do you guys have anything to add?
I was just going to say that you get a real sense when you start talking about technology and use of technology, whether it's the electronic medical record that we're using or the scheduling platform we're using. As you start talking about these tools that we use, you get a real sense for whether or not they have computer skills, whether or not how they communicate, though, that sort of that lack of computer skills. You know, we're willing to train some people, but sometimes we just know that it's not going to work. You get that sense right away too. And I usually explain that we have these tools in place to make their job easier, is what our goal is. We want them to be able to spend more time with the residents, more meaningful time with the residents. And so instead of handwriting things out and having to cross things out and redo things that you have to do when you're not using a technology-based platform for things, it just gives me a sense for where they're at. And most of the time, people, especially our younger people, they're ready for this.
Oh yeah, absolutely. Agree. Marissa, what do you think?
Yeah, I think I really agree with Tom that I don't believe it's helped me hire better, but I really think it's helped us onboard better. They do the schedule themselves. They look at it ahead of time, and then it helps our current employees as well know when they are training someone. We put the note right in there on their shift, so our new hires know, I'm training with Megan. I need to find her on the 100 hall, and Megan is anticipating that she is going to be training Sarah. So it's not a surprise to either of them who they're training with. I remember at my nursing home, we would run into it all the time because although we did use EasyShifts, it was very difficult for me to convince them to move to that platform.
Sure.
And they had some paper products that still they held on to for a couple of years after we started EasyShifts, and that training piece was the specific piece that was really important And so those first few hours are critical for how our employees are viewing us as an organization. If they feel like we are capable and compassionate, and that is a big piece of it.
Let's talk about the use of technology and the reduction of or elimination of your need for temp agency or per diem staff. We all know that that's a big thing out there, right? Everybody's concerned about their ability to hold on to their revenue and all of that. So tell us a little bit about if technology has helped you reduce your need for those type of agencies to be involved in your kind of how you staff. So Tom, lead us off on that answer to that question.
Yeah, I think it definitely has, because you have the ability to see that schedule, whether you're care staff member or manager or whatever, you're able to see things right away. We've been thankfully, we haven't ever had to use agency staff. We've had to use temp or as needed staff. And I think as needed staff are helpful, especially for us. A lot of our as needed staff might be either high school kids who are in a youth apprenticeship program, or people in, students in college that have limited schedules because of, class changes and things like that. So what it does also is for those per diem and as needed team members is they can look up and they can kind of set their schedule of days they can work. So if you have some open shifts and you have several youth apprenticeship students, or you have college age CNA, LPN, RN students that are working for you, they can open that thing up and see, okay, yep, here's my class schedule. I can pick up this shift, half of that shift, and this shift. So it's really helped to have that right in front of them. And because we use that 2-week rotating schedule, they can see it for as long as we put it out for. So it's really helped. It's really helped in that way. And it's also helped take the pressure off of our management team to say, okay, I had 5 shifts open this week. How am I going to get them filled? Well, with using EasyShifts or something like that, it's a good chance that half or more of those shifts are filled before we even have to get involved. So it's helped also our administrative team be able to not get, we keep talking about burnout, not get burned out constantly just trying to deal with staffing, because we have 563 other things we got to be doing.
Yeah, exactly right. Marissa, you were nodding your head. Anything you'd like to add?
Yeah, I definitely also encourage the employees to, when they come to me and say like, oh, I can pick up such and such shift, I help them go through and pick it up on their own, because again, that really alleviates the pressure of them. Oh, well, I wasn't here, or, I was at one of my other communities. And then they know that they can, it's really their schedule. It's totally up to them how they want it to work, if they want to add any days or times into that. And I think at first they get a little nervous, right? Like they're editing the schedule. Gosh, how do you trust me with such responsibility?
Yeah.
But allowing them to say like, it's truly that simple. And I can click the 3 buttons just as easily as you can. Let me help you through that. Really
Sure.
Explains to them that it's theirs, and I trust them. And that piece is really important.
Love it. That anything?
Well, we've never used agency staff. And so, but we do have our own casual per diem employees. I have several, and we use them the same way that Tom was describing. And a number of them are college students or people that have left full-time employment to either be a stay-at-home mom, or maybe they're a retired caregiver. And so I have a number of casual per diem people that will go in and they'll just pick up 2 hours, or they'll pick up 4 hours. They're not always picking up the 8-hour shift, but if somebody has their shift up for grabs and somebody can pick up the 2 hours, maybe it's right over the right time that the person who put it up for grabs needs off. And so, or if it's 2 hours of an open shift, well, it's 2 hours less than our managers have to be in contact with people to try to fill it. So we encourage it all the time. I'll use the messaging feature right through the scheduling platform to send messages out to the team to say, be sure to check out the schedule. There's some hours available on Friday. Thanks so much for picking them up. And that just seems to have worked for us.
Wonderful. Good. I just want to say we have about 10 minutes left, and anybody that's listening to this webinar, if you do have any questions as we get close to the end, please throw those in the Q&A. We'd be happy to ask or answer those as we move through the last few minutes of today's webinar. We're going to jump to a question that I think is important, because I think that one of the things that happens, you can put staffing platforms, you can put any technology you want, right, into play. But if people don't attach themselves to it and use it, then it really isn't beneficial. So what I'd like to hear from the three of you is, how have you worked with your teams to accept the use of a scheduling platform, and maybe some ways you're rewarded, maybe views every so often to the platform, and you check those and you give rewards for that, or, just tell me about what that looks like and how you've kind of prompted people to move through the process of the utilization of technology in their daily lives. So Chad, do you want to start with that one?
We've been using EasyShifts now for several years. So it's we were using just a time clock for our hourly employees. And so the way we promoted it was that this was even before EasyShifts had an app.
Mm-hmm.
And they had to come in every day, log onto the computer to go to it, and just showing each person individually. We introduced it as a team, but we sat down individually with each person to show them how simple it is to go in and use it, to eliminate any of those fears. At that time, I had some people who didn't really care for computers, didn't want to embrace some of that once they saw how easy it was. And then even when the app came out, I really don't have to sell it anymore for employees. They sell it to each other, and they sell it to their friends that don't work here, that tell your employer to. So
great.
Or come work for us.
Right.
Tom and Marissa?
Yeah, I think, I've also been using it, I think, for 8 or 9, maybe 10 years now. So, I remember it being a little difficult for my team to comprehend at first, but whenever I have a new employee, I always just talk about EasyShifts, and I say, it is very adequately named. It is truly easy to use, and that's always their biggest fear, of it being a fairly complex system, but it's very user friendly and it's very simple. And I think once they see that, even for 5 minutes, they are very comfortable in the system and willing to say, okay, yeah, I can totally use that.
Great, thank you. Tom?
Well, for us, we got an online scheduling platform at the request of our staff. I remember how many years we've had EasyShifts now. We had one before EasyShifts as well, which had way more, I'll say, bells and whistles than we even remotely needed. EasyShifts, as Marissa said, is easy. It's much more user friendly. It's what staff wanted, and really, for the most part, especially a lot of the caregivers that we have are typically younger. They love technology. They're so attached to it. It's easy. This phone might take place of a hand one day. Who knows? But so really, to get buy-in wasn't that difficult. The only thing we ever run into on occasion is, okay, you guys know how to make the trades. Make the trade. You don't need to get your director involved. And it's a matter of just being able to show and teach and coach. And they're really willing to use it. I really haven't had pushback on not wanting to use the system at all.
That's great. I think Marissa made a good point earlier that some staff is always going to question the fact that you're giving them the ability to adjust a schedule, right? That's a big responsibility. And it's always been so held close to the vest that the opportunity to have them as active participants could be something brand new to people. But once they find out that they're able to and they can use it, I definitely think it's something that is very helpful to both administration and that frontline worker. I'm extremely excited. We got a great question. So I don't know if you guys have seen that pop up in the QA, but I'm going to read it to you and kind of put you on the spot a little bit and see how we can help Alyssa out. She says, I'm a doctoral candidate doing a dissertation on the long-term care staffing shortage. I'm doing a study to find the best strategies to ease the shortage woes. What sort of information would you like to see in a study like mine that you feel would help your organization? Who wants to jump into that? Marissa?
I think a study to find the best strategies, I think it has to be more broad than what are we using in your own area. So where can we be creative with staffing. And so whether that's creating new positions, creating that flexibility of positions, we as an organization are creating our own sort of conceptual agency staffing where there are employees, but they're not assigned to any specific community. We have 9 communities in our organization where we just have them in this pool of people where we say, pick up a shift in any community that you want on any day, any time, which really is very different from what we were doing even just a few years ago. It was very regimented, like you're hired for 32 hours a pay period and you will work 32 hours a pay period. And so more creative ideas like that, I think, is something that can really help us broadening our reach outside of even the United States. Eliminating barriers to all of that would be, I think, a huge resource for organizations all across the country, not just healthcare.
Great. Thanks, Marissa. Great answer. Chad or Tom, anything you'd like to add to that?
I was just thinking about some information that would be helpful is really sampling people that work in the industry already and find out what is it that they're looking for? What is it that they want? Not everybody's driven by money. We're learning that, it's money's important. It has to be money, but also other things. How important is health insurance? How important is paid time off? How important is flexible scheduling? How important is, with job sharing? Would us helping with childcare? I just recently talked to somebody that they're offering to pay for the first $500 per month of childcare for somebody. As a facility, as a paid employee benefit for their full-time employees. I didn't get into the conversation what happens with part-time and per diem stuff, but so there's a lot of creative things that maybe we as managers haven't thought of. And so going to the people that are providing care in our facilities and asking them what it is that they're looking for.
Great, good points. Tom?
I really echo, and I was going to pretty much say the same thing Chad just said. I mean, we talked about at the beginning of this, listening to our team, but not just our team, but listening to others in any long-term care setting, whether it's assisted living, nursing home, even any healthcare setting, to know what do you want? Obviously, what things have you seen? What things have worked? I think because we get so busy with our day-to-days, I think a lot of us are able to do pretty good at knowing what our staff want, and which is ultimately the most important. But maybe there's an idea that we can't even think of because somebody hasn't thought of it yet that we can bring to our team and like, oh yeah, that would actually be really helpful. So I think any information on things that are working well or different things that we can do would all be excellent information.
Outstanding. We got 2 minutes left, so we're going to do rapid fire. This is the best part of the day, right here, real quick. Short answers. Give us 2 things that you have done at the community level to keep staff. Go. Anybody, any order. Fire.
I think the more listen and then be vulnerable. Acknowledging that you're not perfect and that you make mistakes allows them to also do the same. Great. Good. Marissa, Tom, you were going to say something? Go.
Well, she took listen, but communicate and always praise and reward the wins. You got to keep things as positive as you can as well, on top of what Marissa said.
Absolutely. Chad?
I was going to say asking your employees what they want is an important one. Other things that we've done here is we've created birthdays as a holiday. Any time off. Everybody likes time off. So we have birthdays are a paid holiday for us now.
Outstanding. Love it. Well, I want to thank the 3 of you for participating today. I think it's been a great discussion. There's been some great answers. We appreciate the question we got from the audience as well. This will be sent out to other individuals who weren't able to join us today. So as other questions may come in, I may throw some things out to you guys as well. And in closing, we'd like to say, being pragmatic, even places doing everything right or on the path to do things right may still need some outside help, right? We do understand that. Technology is a great solution to have an interactive way of fulfillment. One click to fill a shift makes it simple and very, very easy. We want to thank you all for joining us today. For more information about some of the things you've heard, you can find us at EasyShifts.com. Again, a big thanks to Chad, Tom, Marissa, and of course, Aging Media, Senior Housing News for their opportunity for us to join them today. Again, thanks so much and have a great afternoon, everyone.